with, well, topping our healthcast today, a recent study is highlighting the need for less invasive surgical options for women with a prior C-section who then eventually need a hysterectomy. Dr. Daniel Gomez with HCA Florida Northwest Hospital is utilizing a robotic innovation which does allow for a less invasive vaginal approach to having a hysterectomy.
When you think about the risks that the patients have, having had a prior C-section and now needing major surgery like a hysterectomy, there's different things that get into play. For example, a prior C-section can increase the risk of a patient having a lot of adhesions, which is basically scar tissue. Scar tissue that distorts the anatomy for the surgeon, that makes it quite difficult to maneuver sometimes, and increases the risk of infection, postoperative readmissions, postoperative infections, injury to surrounding organs, etc. So it can put the patient at greater risk.
So Dr. Gomez says the robotic-assisted vaginal approach does reduce those risks and also allows patients to recover more quickly. And with type 2 diabetes on the rise in the U.S., researchers investigated dietary ways to reduce blood sugar levels. A study compared the effects of time-restricted intermittent fasting to ongoing calorie restriction on weight loss. What researchers found is that the time-restricted intermittent fasting initially did do a better job at reducing blood sugar levels and potentially the risk of type 2 diabetes, but it also did reduce the blood sugar levels. The early beneficial effects of fasting versus calorie restriction appear to disappear, though, after just 6 months, which seems to imply that both the fasting as well as calorie restriction are both just as beneficial long term.